Hey guys, I hope you're having a fantastic day. Thank you so much for joining me. Today is Saturday, August 8th. We're about a week and a half out from surgery at this point. Things are going really slow. I did get a chance though to speak to a couple of my doctors, so I kind of just wanted to attempt to do an update for you guys. We'll see. My apologies if it's kind of all over the place. I'm obviously still not feeling the best. Actually, the pain levels today have been higher than they have been the past couple of days. I'm not really sure why, if it has to do, like with the healing process, if something's amiss and, like I'm hitting a roadblock, or if it's all just kind of like flare-up stuff, because I still have not had my Remicade infusion, which Remicade is a biologic slash chemo infusion that I get for ulcerative colitis, and it also helps with arthritis and a lot of other different things. So I've noticed a lot of different changes and symptoms from being late. So we're definitely just trying to monitor everything, and especially monitoring to make sure that I don't peak any fevers. I could have been exposed to any like acute illness in the hospital, so we're just keeping an eye on everything, because I definitely have a lot of pain in the incisions, which of course is to be expected at this point. But in addition to that, today I'm having a lot of pain in my lungs. It hurts sometimes to breathe and a lot of chest pain, so I'm not super happy about those types of pain slash symptoms. I've been dealing with like a sore throat, which I know they had a problem with the breathing tube during surgery, so I don't know if it's the way the tube was leaning that I have like some bumps and stuff like that from it, or if it's because I'm so late with Remicade that it's like just, like flare-up symptoms, or just something completely not related and like acute or something. Like, it's really hard to tell at this point. And in addition to that, I've been dealing with, since I woke up, a lot of numbness, like since I woke up from surgery actually. And then I've had muscle tightening recently around my incisions, which is quite painful. I didn't really expect that. And then, of course, like normal joint and intestinal pain from, like I said, being late for Remicade. So, yeah, there's just so much I still feel like going on. Everything takes so much effort at this point. I expected, obviously, to kind of be down for the count, but I didn't expect it, I guess, like to be this difficult to do stuff. Everything is literally a huge struggle. And I need a lot of help for pretty much everything at this point. So it's a little bit frustrating at times, obviously, because you just want to be able to get what you need and do what you want to do, and that's just not reality. And it's been pretty difficult off and on Abby. She's so faithful. She does not want to go anywhere. She's really in tune, obviously, with my body, because that's her job. But she's to the point that sometimes she just wants to be with me 24/7 and not leave, to even sometimes go potty. It's like just such an ordeal to get her out. Yeah, so Abby has been pretty much attached to my hip since I've come home. We've been just trying to get her to do little things off and on. When the pain is extremely excruciating, she just has been pacing a lot and like a little bit anxious and stuff like that. And I know, unfortunately, there's not much she can do to help me, and there's not much I can do, because I can't make it all better, unfortunately. But, and yeah, I've also had Sadie has been keeping a close eye on me too, which is my kitty. Yeah, so they just hang out with me most of the day, and we're trying to do a little bit of walking as much as my body will take, and it's actually been a lot harder to walk and like do the staircase than I had anticipated. I knew it was going to be hard, but I didn't know it was going to be quite this difficult on me. So and then of course, like, I'm on massive doses of steroids throughout the day. I have to take them 3 times a day right now. And it's pretty intense and crazy, so I definitely have a lot of like the emotional side effects from that. I've been dealing with some anxiety still. And then definitely depression, which I wasn't really anticipating dealing with a lot of depression, but that's definitely been a thing as well. And it's just really hard because, like, you want to be able to distract yourself from the pain, but you really can't because there's so little that, you're able to do. So I've just been trying to switch off and on, like, different crafts and listening to different things, watching different things. So it's definitely a challenge at this point. So I did see my endocrinologist and my primary care physician both on telehealth. I will be seeing my primary care physician this coming Friday in person. Monday I have rheumatology and another doctor's appointment, which are both telehealth, thankfully, and then Tuesday is Remicade. So we're really hoping to kind of be able to gauge more so where my body is after Remicade and just see what calms down, what doesn't, and just see if any other steps need to be done. Do we need to, like, do any scans to double check anything? So we're just kind of playing it all by ear. My endocrinologist and primary care physician are extremely disappointed in the way that things have unfolded, especially with the surgeon. They kind of feel like, she kind of left me in the dark with all this, and I feel the same way. I feel like she could have done a much better job at telling me, like, preparing me for this surgery. I feel like even though I did do my own research, it was not enough. I really didn't expect it to be this difficult, honestly, and I was given very little information now that I'm looking back. I wish that I had a little bit more information. They made it sound like, oh, it's just like any other laparoscopy, it's no big deal, and that's just not the case at all. It is a very difficult surgery, and nobody really tells you, like, if your body goes into crisis on the operating table, like, how does that affect you afterwards. And like, my doctors were saying that they feel like because my blood pressure was so all over the place, that's part of the reason that I've been in so much pain after. I've had so many symptoms after, and I'm just struggling so much and, like, so weak and everything. So, like, that's really good information, but that would have been nice to know, like, directly after surgery. I just kept asking all these questions, and I was just getting, like, blank stares, like some sort of movie, like, where I felt like people weren't understanding me. And I just kept asking all these questions, and they just, like, stare at you, and it's very awkward. But my endocrinologist slowed down my steroid taper, thankfully, because the hospital had me, or the surgeon really, had me going from, like, 80 to 90 milligrams of steroids all the way down to 16 in one day. And my endocrinologist was like, that's going to just put you in the hospital. You're going to be fighting for your life again. Like, there's no point in going that fast. And I completely agree. Like, slow and steady at this point is the only way to go, and, bite the bullet with the side effects. It's definitely not fun to have to be on this many steroids, but I know this is what my body needs, and doing it slowly is definitely going to be beneficial for me in the end. So the goal right now, obviously, is to handle everything outpatient if at all possible. And so far, we're having success, I guess. I guess that's what you call it. But my primary care physician set me up with another new neurologist. She's not very happy about the numbness that I've been experiencing since surgery, and neither am I. I have read that some patients do have numbness, but some of them also ended up with nerve damage from surgery. So I am a little bit concerned because I've never had this much numbness after a procedure, so I'm definitely a little bit worried about that. So I think it is wise to have it looked into, but at the same time, I just haven't had luck with neurologists, so I'm a little bit nervous about that. I've had, like, bladder issues since waking up from surgery as well, just, like, pain, and then, like, either feeling like I always have to go, or, like, like, the signals are still crossed, which I know I've complained about before, but I don't know, it just feels like, I guess, more intense, I guess would be the word. And yeah, the pain is definitely something that I'm not thrilled with. Again, like, I just feel like it shouldn't be that painful, because I am pretty far out from surgery for that, like, for any of that to be lingering, so that wouldn't really make any sense. I'm trying to think what else. My primary care physician is also setting me up with home PT, which I think will be super helpful. We're hoping to get probably the same person that I had last year, which would be really great. I know that a lot of this is just going to take a lot of time, and it takes, just a lot of hard work consistently. But it's really hard to get back to baseline after just so much trauma to the body. It just takes a heck of a lot longer than you would really like. But I'm like thrilled, honestly, that both my doctors are pretty upset with the surgeon, because it just shows that they, care and they want to do what's best by me. And I definitely find that to be a huge relief at this point. So I'm definitely thankful that they are both trying to help out as much as humanly possible, and I think it'll be good for my primary care physician to take a look at the incisions, since nobody else will be looking at them. Alright guys, so I guess I'm just going to end this video here. I'm sure I missed plenty of stuff, but like I said, the brain fog is pretty bad, and so is the pain. So I will try to do another update soon. Alright guys, I hope you have a fantastic day. Thank you so much from the bottom of my heart for watching this video. Thank you so much for all your comments. I am going to start working on them as soon as I can, responding and everything. But thank you for your grace and understanding. And I'll see you soon. Bye.